Hello, class. This is Quiz to Review, covering chapters 3, 4, and 5. What you see here is an illustration of the external and internal structures of the female genitalia. At the top, you have the mons pubis. Next to that are the labia majora, which are a thicker set of lips that extend from the mons pubis. They are covered partially with hair. The labia minora are a thinner set of lips that hang lower, and they're housed inside the labia majora. You also have the opening to the anus, you have the perineum, the vaginal opening, the urethral opening, and of course the clitoris. As far as the internal structures, it's important for you to know about the fallopian tubes, the endometrium, the cervix, and the fimbriae, which we will talk about in a couple of slides. The female external genital structures are known as the vulva. Again, the mons veneris is also referred to as the mound of love. Two structures that were not mentioned in the illustration were the vestibule and the hymen. Okay. This form of exercise strengthens the pelvic floor in both sexes. These are Kegel exercises. For women, Benoit balls can do the trick. However, for both sexes, they can intermittently disrupt their urine flow for 3 to 5 seconds at a time to strengthen the pelvic floor. When this small raised erogenous area is stimulated, it can trigger strong arousal and intense orgasm, finishing with a female ejaculate. This is the Grafenberg spot. Gynecologist Ernest Grafenberg discovered this area in the 1940s. Dr. Beverly Whipple coined the term G-spot in the 1980s. Colleagues encouraged her to name the spot the Whipple tickle. However, she thought it was more beneficial to pay homage to the doctor and researcher that led them on this journey to learning more about the G-spot. Maria is scheduled for a hysterectomy. Her physician advises her that the surgical team will keep her ovaries intact to reduce her risk of developing blank following the surgery. That is breast cancer. Schedule a screening regimen with your physician. Typically, after age 50, screening should occur every other year. If you start your screenings in your 40s, and there are no indications that breast cancer is present, you'll probably start out with screenings every 2 years. The fringe-like projections at the end of each fallopian tube are called the fimbriae. They sweep the unfertilized ovum along the fallopian tubes into the uterus for fertilization. A female's first menstrual cycle is called menarche. The absence of menstruation is called amenorrhea. Amenorrhea is most common among athletes compared to the rest of the population. The physiological changes that occur during the transition period from fertility to infertility. Forget about the in both sexes comment right now. Climacteric does happen in males. However, we are going to focus on what happens with females. Climacteric is a critical period marking the decline of ovarian activity until the end of ovarian function. This period is typically called perimenopause, okay? When it is accompanied by other health conditions like osteoporosis, coronary heart disease, or Alzheimer's disease, it is then considered climacteric. The end of a woman's ovarian function in itself is menopause. It takes a woman not seeing or experiencing a menstrual cycle for 12 consecutive months, that is menopause. So understand the differences between perimenopause, climacteric, and menopause to answer the question correctly. All right, moving on to the male sexual anatomy. Here you see both external structures and internal structures. You will need to know about the testes and the enclosed scrotum. You should know about the structures of the penis, as well as know about the differences between someone who is circumcised or cut and someone who is uncircumcised or uncut. For your quiz, you also will need to know about the vas deferens, the spongy bodies, the epididymis, the Cowper's gland, the prostate gland, the ejaculatory ducts, and the seminal vesicle. Right? Which male external reproductive structures, the foreskin, gland, shaft, and root, contain the most nerve endings? That would be the glands. The cremasteric muscle, spermatic cord, vas deferens, epididymis, testes, and testes are the underlying structures. However, the tunica dartos and the outer layer of skin house the underlying structures. We are talking about the scrotum. Okay. I do want you to remember that the tunica dartos and the outer layer of skin are the structures that support the underlying structures of the scrotum. Okay. Male sterilization procedure that involves removing a section from each vas deferens. That is a vasectomy. This sperm-carrying tube, called the vas deferens, begins at the testes and ends at the urethra. During a vasectomy, the vas deferens is cut, tied, and in some cases also burned to prevent sperm from exiting the body. The blank produces 70% of semen in an ejaculate. We're talking about the seminal vesicles. It's a pair of small glands adjacent to the vas deferens terminals, and they secrete an alkaline fluid that assists sperm's motility. The blank is located at the base of the bladder and secretes about 30% of the seminal fluid released during ejaculation. We're talking about the prostate gland. Edward becomes intensely aroused, anticipating intimacy with his college sweetheart. When they embrace, clear droplets are released from the glands of his penis that contain active sperm. Which male reproductive structure releases this fluid? We're talking about the Cowper's gland. It is a pea-sized gland located alongside the urethra. It secretes an alkaline fluid during sexual arousal. And the Cowper's gland is also referred to as the bulbar urethral gland. During blank, the emission phase, fluid pools in the urethral bulb, triggering the point of no return, also known as ejaculatory inevitability. We're talking about ejaculation. The accumulation of blood in the three sponge-like tissues, one being the corpus spongium, and two corpora cavernosa are more commonly known as the corpus cavernosum, collectively is responsible for male erection. The capacity for erections is present at birth. Our biological maleness or femaleness describes one term. The psychosocial and psychocultural characteristics associated with our sex describes a second term. Those terms are sex and gender. Are some of the physiological differences in our gonadal sex are women or females have ovaries and males have testes. Also, when it comes to our differences in our hormonal sex, again, the ovaries produce estrogens and the testes produce androgens. Our psychological perception of gender describes our gender identity. How we identify can take many forms. XX and XY represent sex chromosomes. The chromosomal makeup of a female is XX, and a male is XY. The female egg only carries the X chromosome. Therefore, the male who holds both X and Y chromosomes in his sperm determines the sex of the offspring. Remember, there are 23 human chromosome pairs, 22 autosome pairs, and only one sex chromosome pair, totaling 46. Problems occur when chromosomes are missing or when extra chromosomes are present. The hypothalamus, the cerebral hemispheres, and the corpus callosum are areas of the brain that indicate sexual differentiation. Okay. For the male brain, the estrogen-sensitive hypothalamus directs the steady production of testosterone. The two hypothalamic areas are larger in the male brain. The cerebral cortex, the right hemisphere, is thicker, and the corpus callosum is thinner. For the female brain, the hypothalamus's gonadotropin releasing hormone is estrogen sensitive, influencing the cyclic release of follicle stimulating hormones and luteinizing hormones, which allows a female to get pregnant. The two hypothalamic areas are smaller. The cerebral cortex's right hemisphere is thinner. And the corpus callosum, which is a network of fibers responsible for communication between hemispheres, is thicker. According to research, the belief that the female brain is significantly more symmetrical than the male brain is unfortunately unfounded. However, it is known that the hippocampus, which is responsible for learning and memory, is larger in females. On the other hand, the male brain is larger by 10 to 15%. Nonetheless, males and females have different brain wiring, resulting in different behaviors that can be fluid as well as gender specific. Here, we're talking about the characteristics of Turner syndrome. One distinct characteristic of Turner syndrome is that there is a missing sex chromosome. So unlike the illustration that I shared with you a few slides ago about there being 46 total chromosomes, for someone who has Turner's, they're missing one. They also tend to be short in stature, have a small mandible, high arch palate, low set ears, a low hairline, a bicuspid aortic valve. They also have ovarian dysgenesis, so they experience amenorrhea and are infertile. They lack pubic hair. They have minimal breast development. They have a short fourth and fifth metacarpal bones, widely spaced nipples, lymphedema of hands and feet, and a webbed neck. Klinefelter syndrome is a male syndrome. It is marked by, chromosomally, by males whose chromosomes they have extra X chromosomes. It might be XXY, XXYY, or XXXXY. This occurs 1 in every 2,000 live births. They have male sex organs, so they are anatomically correct, but they tend to be sterile. They have feminine characteristics, so a rounding of their bodies and faces. They tend to be tall, thin, and have normal intelligence. These babies are usually identified as female at birth. However, the prenatal female may be exposed to excessive androgens that are produced by her adrenal glands, which masculizes the external genitalia. Talking about fetally androgenized females. Dihydrotestosterone, or DHT, which stands for DHT. This is also termed 5-alpha reductase deficiency. These individuals are typically infertile, and they're physically described as underdeveloped external genitalia, undescended testicles, so they remain in the abdomen, and a small or absent prostate. In severe cases, the prepubescent genitalia may appear feminized. However, at puberty, the sex hormones masculinize the genitalia. We're talking about DHT deficient males. Again, DHT stands for dihydrotestosterone. A condition resulting from a genetic defect that causes chromosomally normal males to be insensitive to the action of testosterone and other androgens at puberty. These individuals develop female external genitals that appear normal. We're talking about androgen insensitivity syndrome, or AIS.